My name is Brenda Nakanwa Jimla. I'm a Senior Programs Officer, Community Health Interventions, Ministry of Health. Today we are here for an inaugural meeting for the operationalization and dissemination of the National Community Health Strategy. And this is our first time in Karamoja as we seek to bring Karamoja to speed on the new developments in the areas of community health programming. The community health strategies, one may ask what is new from what has been taking place. There's nothing much new, we're just reorganizing ourselves, but also refocusing better. But there's also a shift, a strategic shift, Ministry of Health strategic shift from being majorly curative to prevention. But now the community health strategy is emphasizing the need for us to further shift from being disease-based to population health. And so you can see from the discussions we've had discussions from that are rotating around. We are making a slight shift from being predominantly disease identification, management, and treatment to being to looking at the community drivers of disease and tackling that. Then you will see a shift from having segregated implementation of community health interventions and programs to now an integrated priority package that looks at life stages or the life cycles of the citizens in the country. You will see shifts from majorly having the community health workers being the sole providers and initiators of health to now empowering communities to take control and charge of their health. Those are the major shifts. So within that, we are made to move the whole country. Now we are in Karamoja district. Today we had all the 9 districts in Karamoja, and the representatives were the district health officer, the residence district commissioner of the RDC, and the political arm, who is the LC1. And the reason as to why we brought them together is that we wanted to make sure that before we move from Moroto to the rest of the districts in Karamoja, we wanted to be able to take for them a package and to also relay the package in a way that Karamoja and the population and the local government will be able to customize it, to contextualize it to meet the needs of the population. Considering that now also the shift is looking at more of bottom-up planning and management of health services. So the bringing districts leadership in one room and analyzing the condition and the health condition of the region, and also the key drivers of disease and public health concerns in the region was very key. And so you see that from the discussions we've had, we had very good contribution from the district leadership. And this was the start of the buy-in before we moved to the districts. So as we move into the districts, which is going to start tomorrow, some teams are traveling tomorrow, others are traveling next tomorrow, we'll be engaging the entire district leadership, not only health,